Escalation, the act of listening to sounds arising within organs, such as the lungs, as an aid to diagnosis and treatment. Blepharochalasis, a rare syndrome consisting of recurrent bouts of upper eyelid edema associated with thinning, stretching, and fine wrinkling of the involved skin. Cholangiopancreatography, contrast radiographic examination of the bile and pancreatic ducts after the injection of radiopaque dye. Cholecystectomy, surgical removal of the gallbladder. Cryptorchidism, a condition in which one or both testicles fall to move from the abdomen. Cystourethropy, an endoscope used for the visual examination for the posterior urethra and bladder. Dacryoadenitis, an inflammatory enlargement of the lacrimal gland. Dermatofibrosarcoma, a fibrosarcoma affecting the skin. Episiotomy, surgical incision of the perineum to enlarge the vaginal opening for obstetrical purpose during the birth process. Esophageal gastroscopy, examination for interior of esophagus and stomach by means of an endoscope. Glomerulonephritis, acute or chronic nephritis that involves inflammation of the capillaries of the renal glomeruli. Gynecomastia, excessive development of the breast in the male. Hematopoiesis, the formation of blood or of blood cells in the living body. Ichthyosis, any of several diseases, usually of hereditary origin, characterized by rough, thick, and scaly skin. Intussusception, the inversion of one portion of the intestine within another. Kyphoplasty, the surgical filling of an injured or coplast vertebra. Leiomyosarcoma, a sarcoma composed in part of smooth muscle cells. Lithotripsy, a treatment typically using ultrasound shock waves, by which a kidney stone or other calculus is broken into small particles that can be passed out by the body. Menorrhagia, abnormally profuse menstrual flow. Nephrolithiasis, a condition marked by the presence of renal calculi. oligohydramnions. Deficiency of amniotic fluid, sometimes resulting in an embryonic defect through adherences between embryo and amnion. Onychocryptosis, a form of nail disease in which nails are ingrown. Oophorecystectomy, surgical removal of an ovarian cyst. Pancytopenia, an abnormal reduction in number of erythrocytes, white blood cells, and blood platelets in the blood. Pheochromocytoma, a tumor that is derived from chromaffin cells. Puerperium, the period between childbirth and the return of the uterus to its normal size. Rhinomycosis, fungal infection of the nasal mucous membranes. Spondylolisthesis, forward displacement of a lumbar vertebra on the one below it. Syncope, loss of consciousness resulting from insufficient blood flow to the brain. Vasectomy, surgical anastomosis of a divided vas deferens to reverse a previous vasectomy. Vitiligo, a skin disorder manifested by smooth white spots on various parts of the body.